Hi, this is Michael Altos, and this is our final video on the subject of antimicrobial agents, Part 3. Now let's talk about a series of other antimicrobial agents. The first group we'll talk about are the macrolides. These include erythromycin and the famous azithromycin, which is the Z-Pak. These are drugs that target protein synthesis and the ribosome. They are bacteriostatic, which means they inhibit protein synthesis by binding to the ribosome and prevent the bacterial cell from maintaining its normal functions. These drugs work mostly against gram-positive bacteria and some gram-negative bacteria, especially azithromycin. Common adverse effects include GI upset, and this may partially be due to increased GI motility, as we see with erythromycin, and we've discussed this in previous lectures. Other adverse effects include fever, rash, eosinophilia, and inhibition of the cytochrome P450 enzyme, leading to increased drug concentrations of certain medications and prolonged effects of midazolam and alfentanil. Tetracyclines also fall into this category. Doxycycline is the most common. These are broad-spectrum antibiotics which are bacteriostatic. They inhibit protein synthesis by binding to the ribosome. They are effective against gram-positive and some gram-negative bacteria, and are commonly used in the treatment of acne, urinary tract infections, respiratory infections, and chlamydia. I have seen them used occasionally during D&C procedures. Tetracyclines have a number of adverse effects that we should be aware of. They can cause GI upset like many antibiotics, not only because of bacterial overgrowth, but also because of local irritation. They can also cause normal flora suppression, which causes overgrowth of bacterial or candidal species. Tetracyclines can cross the placenta, and this is significant because they can bind to calcium, which exists in bones and teeth, and they can lead to deformation, inhibition of growth, or discoloration of these organs. For that reason, we don't give them to pregnant patients, and often we don't give them to children either. Patients taking tetracyclines may experience extra sensitivity to sunlight, leading to skin staining, as well as dizziness and nausea and vomiting. And tetracyclines may increase the activity of neuromuscular blockade. Clindamycin also falls into this category of protein synthesis antibiotics. It is bacteriostatic. Once again, it inhibits protein synthesis by binding to the ribosome. And I've seen that clindamycin is one of our most common alternatives to penicillin and cephalosporins in patients who have an allergy. Clindamycin is effective against gram-positive bacteria and also has pretty good coverage against anaerobes. And so not only is it a good alternative to beta-lactams, but it has a lot of use in ENT, GI, and GYN procedures where anaerobes may be an issue. The dose is usually between 600 and 900 milligrams IV every 6 hours. Common adverse effects include GI upset, rashes, and C. difficile infection. The textbooks say that you can have histamine release with quick administration, although I haven't really run into that problem in my practice. And it may once again cause or potentiate neuromuscular blockade. Next in this group of protein synthesis antibiotics are the aminoglycosides, most commonly gentamicin. Gentamicin is usually bactericidal. It inhibits protein synthesis and binds to the ribosome. It's effective against anaerobic, gram-negative, and even some gram-positive bacteria. And it's effective against abdominal infections, urinary tract infections, endocarditis prophylaxis, and Pseudomonas. We will commonly see gentamicin given together with a cell wall agent like nafcillin or vancomycin. And I've seen it used a lot in neurologic and spine procedures. A typical dose of gentamicin would be 80 milligrams IV for an adult, although high-dose protocols exist, which would be 5 milligrams per kilogram with a maximum of 400 milligrams. Aminoglycosides have a risk of ototoxicity, which is irreversible, as well as mild nephrotoxicity. To prevent this, they must be given slowly to keep serum levels low. If we're just talking about 80 milligrams, you can give it as a slow bolus, but higher doses should probably be put into a bag and infused over a period of 15 to 30 minutes. At high doses, aminoglycosides can cause neuromuscular blockade, and hypersensitivity reactions to these drugs are not common. That's it for the protein synthesis antibiotics. Please let me know if you have any questions about any of the material. And now we're moving on to different classes of antibiotics. The next is Bactrim. Bactrim is actually a combination of two drugs, trimethoprim and sulfamethoxazole. This is a bacteriostatic antibiotic which hits two different steps in the conversion of PABA, para-aminobenzoic acid, to THF, tetrahydrofolic acid. This is part of the folic acid pathway, which is necessary for synthesis of purine, which is an important component of DNA. As a result, Bactrim is effective against both gram-positive and gram-negative bacteria, as it interrupts their DNA synthesis. Adverse reactions to Bactrim include fever, rash, photosensitivity, nausea, vomiting, and diarrhea. There is some question about whether it's safe to give to pregnant patients, as it may increase the risk of birth defects when given to patients in their first trimester. And finally, Stevens-Johnson syndrome, which is a very severe skin condition, is a rare but serious side effect described with Bactrim. Fluoroquinolones include drugs like ciprofloxacin, gatifloxacin, and moxifloxacin. They are bactericidal. They inhibit DNA gyrase. Drugs like gatifloxacin and moxifloxacin are effective against gram-positive and anaerobic bacteria, while ciprofloxacin is more effective against gram-negative and Pseudomonas. I see fluoroquinolones being used a lot in genitourinary cases. The package says it should be given over 1 hour, and side effects include nausea, vomiting, and diarrhea. And some litigation exists describing tendinitis and arthropathy after exposure to fluoroquinolones. Metronidazole, also known as Flagyl, was originally an anti-protozoal agent, so it was useful against the parasite protozoans. But it also has antibacterial properties, mostly against anaerobic bacteria. It's bactericidal by disrupting electron transport and is effective against bacterial vaginitis and trichomoniasis, Clostridium difficile, abdominal infections, and brain abscesses. These are all places where oxygen is minimal, and therefore we see anaerobic organisms. The side effects of metronidazole include nausea, vomiting, diarrhea, and a Disulfiram-like effect, which means that when patients ingest alcohol, they may become ill. Some people suggest that you should avoid metronidazole in the first trimester of pregnancy, but data is limited. Well, that's the end of our discussion of the common antibiotics that you may be asked to administer in the operating room. As always, please contact me with any questions, and thanks for tuning in.